This program was made possible with the generous support of the Magnolia of Millbrae. The Magnolia of Millbrae is a senior living community that provides a variety of services and amenities to its residents. For more information, call 650-697-7000 or visit their website at www.themagnolia.com. MCTV thanks them for their support.
Welcome to Wellness Update. My name is Sherry Plambeck. I'm the Director of Sales and Marketing at the Magnolia of Millbrae. We're located in Millbrae, California, and we're a senior retirement community offering independent living and assisted living. Today our topic is stroke prevention. Our guest is Nancy Houston Miller. She is chairman of the board of the Pacific Stroke Association and a clinical nurse researcher for the School of Medicine at Stanford University. Nancy, welcome.
Thank you, Sherry, and thank you so much for having me today.
It's our pleasure to have you here. Can you explain to me, Nancy, what is the Pacific Stroke Association?
Certainly. The Pacific Stroke Association was started actually in 1999 by a handful of people, a couple of whom had had strokes and had not had such good experiences, and they decided to form a new organization really designed to help to educate the public and make them aware of stroke signs and symptoms. And secondly, to provide support to people who had suffered a stroke and also their family caregivers. So we really have two goals in mind: raising awareness and supporting stroke survivors.
So Nancy, tell me, what are symptoms of stroke?
Well, symptoms of stroke, which everyone should be aware of, include everything from severe headache in the case of one type of stroke, which we'll talk about in just a few minutes, but secondly, everything from looking at weakness on one side of the body that can occur primarily on the arm or the leg. Normally, slurred speech is another sign. Blurred vision, or dimmed vision is another sign. Unexplained dizziness or lack of balance is another sign. And certainly difficulty understanding or speaking words, another sign. Now, two ways to really help individuals to remember the signs of a stroke are the acronyms FAST and SOS.
Now, what do those stand for?
FAST stands for face, and you can look to see if the face is uneven on one side. Arm, and you can look to see if an arm is weak on one side. S stands for slurred speech, and so you can ask somebody to speak and you'll find that they aren't able to speak or their speech is slurred. And T stands for time, and time is of essence. So calling 911 and getting somebody into the medical emergency room in order to get them support is really critically important. And we're using FAST as the primary acronym. However, another one you can also use is SOS. And SOS is really looking at smile. And if somebody cannot smile, it's normally a sign. If you ask somebody to hold their arms up, make a circle, normally one arm will fall if they've had a stroke. And the other one is to ask them to speak. And it's, again, slurred speech that you're looking for. So SOS is also another way to look at, do we have a person that's had a stroke or is encountering a stroke?
Now, what are the different types of strokes?
Well, there are really two main categories of stroke. About 88% of all strokes are what are known as ischemic strokes. And these are normally, a stroke is really an interruption in the process of blood flow to the brain, and or an artery which is actually burst open. and which causes a stroke. And essentially, an ischemic stroke, which is the most common, occurs when there is a lack of blood flow and a lack of oxygen to the brain as a result primarily of a blood clot. And that blood clot can normally occur anywhere in the body. It can occur in an artery in the brain, which is a cerebral blood clot or a cerebral stroke, or it can occur in a leg or in the heart, and it can dislodge and move up into the brain, the clot, and cause a stroke. So that's an ischemic stroke. And then about 12% of all strokes are known as hemorrhagic strokes. And they are caused primarily as a result of a weakness in the wall of the artery that eventually opens up and causes blood to spew everywhere within the brain.
Are any of those hereditary at all?
Certainly strokes can be hereditary, and especially, both ischemic and hemorrhagic, I should say. Hemorrhagic strokes, people can have what are known as aneurysms, which is a bulging or an outpouching of a vessel, whether it be a vein or an artery in the brain that eventually opens up. And we sometimes don't know that we have aneurysms. A genetic defect, which is known as an AV malformation, which is again that causes a hemorrhagic stroke. And the symptoms are also a little bit different. People that have hemorrhagic strokes often have very, very severe headache, the worst headache that they've ever noticed. And it also may cause severe nausea and vomiting as a result of the headache because there's so much pressure that's built up as a result of blood spewing everywhere within the brain. People that have ischemic strokes, which are much more common, have risk factors very similar to those individuals that have a heart attack. And so family history becomes important in that regard.
Now, what is a TIA?
So a TIA is known as a transient ischemic attack. And a TIA is really, people used to say the word, well, somebody's had a mini stroke. There is no such thing as a mini stroke. And so a TIA really means that people have had symptoms. It's a temporary loss of blood flow through an artery, but it resolves. So the clot may not lodge, may not close off the artery in terms of blood flow and oxygen, but it occurs temporarily. And people have symptoms. Those symptoms may last anywhere from a few minutes to a little bit longer period of time. Normally when people have a TIA, their symptoms are less than an hour. And what happens is people don't react to those symptoms. And in fact, 50% of all people that have a TIA don't respond to those symptoms by seeking medical attention. And what is important here is that 15% of TIAs result in a stroke occurring within a very short number of hours to days following that TIA.
So can a person have 4 or 5 TIAs, say within 5 or 6 months?
Yes, absolutely. And the most important thing is that we treat TIA as a stroke and that people seek medical attention, because we do have medications and treatments for TIAs that many of the neurologists and stroke physicians will recommend. And so treating a TIA is as important as treating a stroke.
Now, what is the recovery process for someone that has had a stroke, whether it's ischemic, hemorrhagic, or even a very small TIA, which is still considered a stroke?
Exactly. Well, the recovery period, as most stroke survivors will tell you, goes on forever. So we treat this pretty much as a chronic condition for many, and it also depends upon how much damage has occurred as a result of the stroke. But it involves everything from physical rehabilitation to occupational therapy to speech therapy. And people will tell you even 10 to 15 to 20 years after they've had a stroke that they're still recovering and they're still learning new things in terms of the rehabilitation process. So there's much to be learned from survivors, stroke survivors, in terms of the ongoing process of recovery from a stroke.
Now, San Mateo County, we're very fortunate that we have so many certified stroke centers. But a lot of counties, I think, throughout the United States don't necessarily have that many certified stroke centers. Am I correct in that?
You're correct. I mean, stroke centers are those centers that have been acknowledged by the Joint Commission for Hospital Accreditation and the American Heart Association, American Stroke Association, and others as having followed the important guidelines put forth for stroke recovery, stroke prevention, and so forth. And they have literally, these hospitals have stroke teams that have been truly trained, all the way from dealing with the paramedics to the emergency room to getting people into appropriate treatment as quickly as they enter the emergency room. And so we are very, very lucky in the state of California that both San Mateo County and Santa Clara County have almost every hospital certified as stroke centers, which means also that a neurologist is going to be available and to an emergency room at all times when somebody comes in, whether day or night.
So that's 24/7, the neurologist would be available.
24/7.
How can we prevent a stroke?
So it is believed that at least 80% of all strokes could be prevented. And the risk factors for preventing stroke are very similar to the risk factors for preventing a heart attack.
Is diet a component?
Diet is certainly a component. And we know that with regard to stroke, the most significant risk factors include, for younger individuals, smoking, which is the single most important risk factor in terms of causing an ischemic stroke, where there's lack of oxygen, lack of blood supply to the brain. And essentially what happens is it turns out with cigarette smoking, there's interruption in blood flow and a buildup of what is known as fibrinogen, which is one of the components of blood, and platelets that actually adhere to the wall of the artery, which can then cause the artery to become blocked. And the end of the blockage is really the formation of a clot. So smoking cessation becomes critically important. For individuals that don't smoke, the single most important risk factor is high blood pressure.
And what should those numbers be? I mean, that miraculous number of 120/80 that we hear about all the time. But yet some physicians say, well, it's a little bit higher on the systolic, it's okay. But can you explain that a little bit?
Well, there have been, in the last couple of years, revisions in the guidelines, so to speak, and the American Heart Association right now is convening a panel of experts to come forward to really look at all of the literature and randomized controlled trials to look at determining what are the most appropriate numbers. I would have to say that 120/80 is ideal blood pressure. That's optimal. And we also need people to understand that anything above 140/90 is elevated blood pressure. And for those individuals that have diabetes, blood pressures of 130/80 are considered to be high blood pressure. And so unfortunately, about 1 in 3 adults in this country have elevated blood pressure. The most important thing being that blood pressure is controlled.
So if the blood pressure is 130/90, that does not necessarily guarantee that a person is going to be afflicted with a stroke, but it's certainly a warning sign that one better beware.
That one should be aware and that one should work toward with their physician, at least talk to their physician about determining how can they lower that lower number, which is right hovering at being elevated.
And
anything
how
above
can
90.
one lower that lower
So
number?
the most important things that we can do from a lifestyle perspective, I mean, blood pressure is primarily controlled with medicines for many, many people. But from a lifestyle perspective, to lower blood pressure, the biggest lifestyle change that people can make is to lose weight. So weight loss, exercise, and changing diet become very important in terms of lowering blood pressure. Sodium restriction, for example, to 2,300 milligrams per day actually helps to really lower blood pressure. Alcohol restriction of no more than 2 drinks for men and no more than 1 drink for women is important in keeping blood pressure under control. And certainly when we find weight losses of even 5 to 10 pounds of weight, this will lower blood pressure significantly.
So it's not unbeatable. I mean, one can really try
Exactly.
to lower the blood pressure point.
Right.
Now, what about the issue of cholesterol? We hear so much about, the good cholesterol and the bad cholesterol. How does that play a role in this?
So cholesterol is also important as a risk factor, and the majority of the cholesterol molecule is made up of LDL cholesterol, which is the bad cholesterol. In fact, it makes up about 70% of the molecule. And what happens is we need cholesterol for cell growth, and when we ingest foods and things like that, which are high in saturated fat and cholesterol, but primarily saturated fat, we get an increase in the number of LDLs that we probably more so than we need. And unfortunately, they circulate in the bloodstream,
which is not good.
And they go immediately to the artery walls, unfortunately, and they build up, just like, you've heard of plaque building up in arteries of the heart. The same thing happens with plaque building up with arteries of the brain. And so we don't want too much LDL, and the important thing is we've done away with these new guidelines with numbers in terms of how low does your LDL cholesterol need to be. The important thing is that a 30 to 40 to 50% reduction in LDL is probably not too bad for any of us as we age and as we look at the importance of cholesterol for stroke prevention.
Now, what should a person do if they think they see another person having a stroke?
The important thing to recognize is stroke is a medical emergency. And immediately if they see anyone having symptoms, it is call 911. Because what happens is if we can get people into medical attention within 3 hours of the onset of symptoms, there are many things that we can do in the emergency room in getting people the appropriate treatments that are necessary for the type of stroke that they are encountering.
So with an ischemic stroke, what is the procedure that would be used in the emergency room for that?
Well, most of the time, the most important thing is that dependent upon when people get there, the first thing that people would do is obviously to get the stroke team there to the emergency room, and they're there before a patient ever arrives. The paramedics are calling ahead and letting people know that they have stroke people or a stroke victim potentially on the way. They then will do normally an MRI or a CAT scan to determine what type of stroke it is. Do I have a patient that's got a hemorrhagic stroke or an ischemic stroke? And like with a heart attack victim, which is important in terms of getting somebody into medical attention immediately as well in order to decrease the amount of damage, we advocate trying to give somebody an aspirin on the way in order to prevent the amount of damage from occurring within the heart. We don't recommend that in relationship to strokes because we don't know until somebody gets to the emergency room if they're having a hemorrhagic stroke or they're having an ischemic stroke. And with hemorrhagic stroke, you don't want to give aspirin in terms of continuing to because it relates to bleeding in relationship to individuals.
So better not to take And aspirin at
Better
all?
not to take it, better not to do anything other than to move as quickly as possible to calling 911 and let the paramedics take over.
And what are the latest treatments in stroke prevention, and certainly when one has been afflicted with the disease condition?
Right.
What are the latest treatments out there for
So-
people nowadays?
So the latest treatments really in terms of people that are having a stroke, with hemorrhagic stroke, the two things that you really want to do are to lower blood pressure as much as is possible, and then to get people into surgery to determine, they're bleeding within the brain, and to determine, are there AV malformations, aneurysms, things that can be done surgically to help a stroke victim. For a person that has an ischemic stroke, we're obviously treating with different types of medications in the emergency room and thereafter, anticoagulants, antithrombotic agents. We use what is known as tissue plasminogen activator, or TPA, which you've heard about, which actually, if given intravenously, will actually lyse the clot and get rid of it very, very quickly. And that's one of the reasons why we get people in as quickly as possible, because brain cells die, and the surrounding tissue can also die very, very quickly. And so treatment becomes important. One of the other things that we've seen that has been highly successful is catheters being put up through the groin into the brain, similar to doing an angioplasty or an angiogram, I should say, with a heart patient. And now we have them with the tiny cerebral arteries, and we have catheters that actually can remove the clot in relationship to getting up into the cerebral arteries of the brain.
So if a person has had a hemorrhagic stroke and they're in the operating room and you're trying to control that clot and dissolve that clot, can that clot occur someplace else and the person could again have another aneurysm elsewhere in the body?
A person can certainly have had more than one aneurysm. What you're attempting to do at the time that the person has a stroke and is really to decrease the bleeding. So hemorrhagic stroke, you're really trying to decrease the amount of bleeding that is occurring, which is rather than with ischemic stroke, you're trying to get that clot out as quickly as possible, and do that through the use of TPA or the use of an angiogram and potential angioplasty.
Now, with all the latest treatments that are out there on the market, can strokes really be prevented?
As I mentioned earlier, actually about 80% of strokes can be prevented. And that is, we have to pay close attention to the risk factors that we know are critically important as adults, and really, and as young people as well, especially those who have family history. And this includes everything from not smoking to managing high blood pressure to looking at whether or not you have diabetes, which is a risk factor for stroke, and making sure that the other risk factors are controlled if you do have diabetes, to looking at a risk factor that's different for stroke than heart attack, which includes atrial fibrillation. Now, when atrial fibrillation is an irregular heart rhythm that occurs in the right atrium, or the left atrium, I should say, when the heart beats 4 times faster in that part of the heart compared to the lower chamber or the ventricle of the heart, which then causes an irregular flow in the blood, which has a tendency to build up clots. And clots can again form in any area of the body.
Is that something that is more common in, say, a more mature individual?
It is most common actually in older individuals, and about 1 in 4 strokes in individuals over the age of 80 will occur as a result of atrial fibrillation. So and atrial fibrillation is primarily controlled by medicines, in most cases, and what is known as cardiac ablation, in which we can find the area that's causing the irregularity and pretty much get rid of it.
Now, how many times can a person have a cardiac ablation?
Actually, they can probably, I'm not really as up to date on that. I mean, I know of individuals that have 3 and 4, ablations
In a lifetime.
In order to get their atrial fibrillation or other irregular heart rhythm under control. So it can be certainly done more than once.
So if a person has suffered from a stroke and is going through the process of mending, etc., are there support groups that they can be a part of and their families?
You know, one of the most important things that the Pacific Stroke Association does is to really let stroke survivors and their family caregivers know about how they can get support and help from others that have suffered strokes. And one of the ways in which we've done this is that many of the hospitals and many groups in the community have set up stroke support groups. And so that's one of the goals of PSA, is to really inform individuals of when are those stroke support groups occurring in the community, where are they located, how can they get involved. And another important thing that the Pacific Stroke Association has done is to formulate a resource directory of all of the resources for stroke rehabilitation and treatment within the 2 counties. This is done every 2 years. All of the hospitals in both counties utilize this resource directory, and it is just full of important resources for people who have just suffered a stroke, so they don't feel alone in relationship to dealing with this particular condition.
Because I think a lot of times the families are at a total loss as well, and a lot of different issues can come up.
I would totally agree. I mean, and for members who are caregiving, especially in the early days following a stroke, it becomes, very, very difficult, and people need support.
Now, with the Pacific Stroke Association, if a person wanted to volunteer, do you have volunteer positions available that people could be part of, say maybe through a stroke support group at a local hospital, or how does that work?
We do have. We're always looking for volunteers for various activities that occur for the Pacific Stroke Association, and whether it be medical professionals who are interested in giving lectures to the community, whether they be in libraries, community centers, senior assisted living facilities, such as the one that you are heavily involved with. We're always looking for guest speakers that can become trained or who are working in this particular field to give lectures. But we also have many opportunities for other people to volunteer, whether it be for an event, an educational event, or a fundraising event. Pacific Stroke Association, we have lots of volunteers and would love to have people
what if a
supporting
person
us.
Wants to volunteer just to maybe relieve a family that is going through a great deal of turmoil right now? Is there a training that people could take to volunteer and say help a family out, or certainly give a little bit of relief or drive people perhaps to a medical appointment?
We don't have anything like that set up, Sherry, but one of the things we're piloting right now is what is known as Stroke 101, which is essentially a group or a way for stroke survivors to come together and to really receive a lot more in terms of education. And these sessions are being held actually twice a week for a series of 4 to 6 weeks at Little House in Menlo Park. We hope to evaluate the success of this particular program at the end of this year and then expand our reach. And they're for stroke survivors and their spouses and their caregivers to really get into a lot of issues that may not be discussed, such as things like depression and anxiety and the kinds of emotional feelings that go along for individuals that have a stroke. So I would encourage people, especially caregivers who want to become better trained, to hear about Stroke 101 and how they can get involved in attending some of these educational sessions.
Well, Stroke 101 sounds like that's a great opportunity for many, many people, and for many people to learn and share their particular difficulties. And certainly the good news is that if one has had a stroke, they're always on a recovery path, but usually that recovery path is going to be uphill rather than having too many downfalls along the way, which I think is really crucial.
Right.
Stroke, I recently read an article and it was stating that stroke is the number 5 killer within the United States.
It's really, I think if you look at most publications, it's probably the number 4, probably wavers between 4 and 5 in that regard. It is the number 1 important, factor regarding disability. So, or the disease, I should say, condition related to disability. So that's important to recognize. But yes, it's very, very high up there in terms of overall death rates as well.
And it can afflict anybody at any time.
Can.
So nobody is immune.
Nobody is immune. It can affect young and old. I mean, stroke, the rate of stroke tends to increase with age, certainly. In about the 5th decade for men and about the 6th decade for women, similar to heart disease. And however, we see strokes in young people as well, and important risk factors such as smoking, those kinds of things, can cause stroke.
So really controlling the diet is crucial.
Yes.
I guess it goes back to the adage of more healthy vegetables and fruits.
Right.
Picking your poisons, picking them well. You can certainly still have a glass of wine if you wish as a female, or 2 glasses as a male.
Right.
Smoking is certainly something that one maybe does not want to pick up as a habit in life. But I thank you so much, Nancy, for coming to visit with us today and sharing so much news, because stroke, the key is to get to a hospital immediately, call 911,
right,
and then just hope for the very, very best from that point on. And always remember, everybody is on a path of recovery, and it is an uphill path.
Yes.
I thank you so much.
Thank you. Appreciate being here.
It was our pleasure to host our show today. I hope all of you found it of interest, and we thank you so much for tuning in. Live each day. Life is so very precious.
This program was made possible with the generous support of the Magnolia of Millbrae. The Magnolia of Millbrae is a senior living community that provides a variety of services and amenities to its residents. For more information, call 650-697-7000 or visit their website at www.themagnolia.com. MCTV thanks them for their support.